With conventional dentures, you only have 10 to 20% of your functional ability. However, with a full arch restoration such as All-on-X, you regain your full function almost up to 90%. Many years, dentures have served us very well, but we didn't know any better. We didn't have any other options. Now, with the newest technologies and advancements in dentistry, especially with implant dentistry, patients do not have to use dentures anymore. With All-on-X treatment, we place 4 to 6 implants very strategically on the jawbone. That's going to allow us to place a full arch bridge that's going to be fixed in place. That doesn't come out. You don't have to take it out. When you eat, you don't have to clean. All you have to do is brush and floss and clean like your regular teeth. When you use a denture, because of the pressure that it applies on the bone through the gum tissue, you actually lose bone over time. That's why the dentures feels loose over the years. With dental implants, because we preserve the bone, we do not actually lose the bone over the years. To help our patients preserve their investment for the rest of their life, to make sure that their teeth are in great condition, it is very important that they come to their hygiene and maintenance appointment every 4 to 6 months. In these appointments, we take the teeth out, we inspect them, we clean them, we make sure that all the abutment screws, all the prosthetic screws are in good shape. And if they need to be changed, we change them. And the patient leaves here with brand new screws, whatever they need. Now, this is our part. At home, they have to make sure that they brush their teeth daily, floss them, use a water pick, and that's pretty much it. Take care of them as if they are your natural teeth. To learn about more All-on-X treatments, call small rehab centers and schedule your free consultation and your small preview so that we can come up with a customized treatment plan for you.